Thank you, Chairman, for holding the meeting today, and thank you all for being here. Ms. Wood, is that her real name, or is it Charlotte? Okay, I have a daughter, Charlotte, much bigger than your Charlie, but I've always called her Charlie. So, Dad, please don't call me Charlie. Call me Charlotte. So, thanks for being here, and your story is very relevant to being here today. What I'm really concerned with is that this is actually, when we have these meetings and these hearings, it becomes a forum to actually give speeches to people. And I think that's fine. I have no problem with that. I do know that we talked about Daniel Patrick Moynihan. I'm a big fan of his. One of the things he also says, you're entitled to your own opinion, but you're not entitled to your own facts. I don't think there's anybody on this dais today that doesn't want to see Americans have health care. But I think the real question is it just having health care, or is it having quality health care? And so are we giving people a choice of what it is they want, or are we giving them control over their own health care? Now, very famously, and I think President Obama, when he said it, he meant it. If you like the plan you're on, you can keep it. If you like the doctor you have, you can keep him or her. I think he thought that was actually part of what was in there, but it wasn't. Now, as an employer, I do supply, for the people that I work with every day for mutual success, health care. Now, Mr. Chair, I just want to go to you. So, under this Medicare for all, a person like myself, or many other millions of people in Pennsylvania, over half of Pennsylvanians are covered by an employer-sponsored health care program, including many of our brothers in the unions. They've fought generations to get these type of coverages. What would happen under Medicare for all? Would these options still be available?
Under most of the proposals, those plans would end. The employer would therefore be likely paying taxes to the federal government to support coverage for their employees. But it basically they would also be paying higher taxes, higher corporate taxes, other taxes. So that coverage would end.
A lot of the district that I serve, Pennsylvania 16, we have rural hospitals. They tell me that part of their revenue for running their hospital comes from Medicare and Medicaid programs. They tell me they are underpaid for the services they provide. Is that a true statement?
Absolutely. My colleague Doug Badger wrote an extensive paper showing that employer-sponsored health insurance actually does support Medicare and Medicaid's underpayments to doctors and hospitals, and is largely responsible for keeping the doors open.
Okay, so there's an old saying, what you don't make on the apples, you have to gain on the oranges that you sell. So if you don't have that other source of revenue coming in, just from a business standpoint, how do these rural hospitals operate? In fact, over half of the 16 hospitals in Pennsylvania's 16th Congressional District are operating in the red, which means they're losing money, for those of you who don't follow that type of a philosophy. So they would continue to lose money, and they'd lose more money, and eventually, the way businesses work, after a while, you go out of business.
That's right. They could not sustain a 40% cut in their revenues and still continue to keep their doors open from those private patients that they treat.
Okay, and also the devil's in the details. What kind of paper would we be talking about? What kind of red tape would this new bureaucracy be creating for every single healthcare provider that's out there today?
It does surprise me to think people think that if the federal government's in control, there's going to be less bureaucracy and less paperwork. I don't think that's going to be the case. Doctors, many of the same things that have to happen now will have to happen under Medicare for all. Doctors will have to document that they provide the coverage, that it was provided under the new rules or regulations. There will be a global budget determining whether or not services and equipment are available to hospitals. Significant changes.
Yeah. So as we all want, and I'd rather talk about quality health care. So an organization that's running somewhere around $22 trillion in the red, they are the people that are going to be advising our health care providers the way they should run their programs. It's bizarre. It's bizarre, but that's the way we think. We often think that people on their own can't decide what's good for them. They have to have some larger entity out there making those decisions. I think it's actually critical that we start to look at the cost of this. $32 trillion is a lot of money. We can't even comprehend what it is, but I think what it does mean is this Medicare for all means quality care for none. This is a scary place that we're going right now. While it may sound good on the campaign trail, I would hate to see what it happens.
Please, 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 will the gentleman please sit? Please, 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 please. Please.
Well, reclaiming my time,
Please.
this does bring out the best and sometimes the worst in people. There is an answer to where we're trying to go, and us work.
Please, let the gentleman finish his statement, please.
Thank you, Chairman. I'm glad there's more people here than the people at the panel. But really, we can work together to get this done. As long as we make it about policy and not politics, there's opportunity for great things to be done. Unfortunately, we're in an election cycle right now, especially in a primary cycle, that doesn't allow us to do the things that we know are right for America. So thank you all for being here. Mr. Chairman, thank you for having this hearing. And I look forward to making sure that Americans have quality health care. I just don't think this path we're going down right now is the right way to go. Thank you, and I yield back.
Thank the gentleman. Let me recognize the gentleman from Oregon, Mr. Blumenauer, to inquire.
Thank you, Mr. Chairman.